Hey, everybody. Welcome to today's discussion at Jaffe Chiropractic. I am Dr. Jaffe, and I am so excited to share the stage with my friend, Dr. Sarah from Healing Hands Pelvic Health and Wellness. We're going to be talking today about a topic that's incredibly important for new moms, managing pain after childbirth. We're going to explore how both chiropractic and physical therapy play essential roles in postpartum recovery. So let's dive in.
Thank you, Dr. Jaffe. I really appreciate you having me here today. And I'm very excited to talk about these topics with you because they're very important and things that we go through every single day.
So many people out there that really don't understand pelvic floor health. So this information is going to be super helpful for them, for moms, not only moms, but also dads, partners, anybody else who knows somebody who's dealing with this. So one of the most common issues that I see with my patients after childbirth is pelvic misalignment. And that can produce a lot of discomfort and even long-term pain, even past that fourth trimester. Chiropractic care, we really focus in on joint function, bones, on the nervous system, how things are moving. We're looking for areas of abnormal stress where joints aren't moving correctly. There's ligament pressure. Muscles are dysfunctional. In chiropractic, when we restore motion to these joints, we take that stress off those areas. We're able to reduce those symptoms, reduce pain, increase stability, and increase mobility. From your perspective as a physical therapist, Dr. Sarah, tell us, how does your approach come about for pelvic stability after childbirth to help people with these problems?
When I talk about pelvic stability with my clients, I really also refer to the trunk as a whole because what it ends up being is it's not only the pelvis, but it ends up being a corporation of the pelvis, the core, the diaphragm, and the low back. And all of these things need to be working in synchrony in order for there to be good equal pressure distribution, equilibrium, and for everything to be going well. And this is the same thing with pregnancy. Already during pregnancy, this is changing because of the growth of the baby. And then certainly afterwards, now we've got other issues happening, like the pelvic floor has now gone through the ordeals of giving birth. The back had changed my posture, which affected our back. Our core now, a lot of times when people experience asus recti, where there's separation of the abdomen because of the core. And so I have to factor all these things in when also looking at pelvic stability. Typically, what I'll see is maybe people that are coming in for a pubic symphysis dysfunction. So when they're getting stress separation, because that can happen during pregnancy, it can happen afterwards as well. When they feel like as they're moving or even getting out of bed, they're noticing some pulling or tugging or pain within their pubic region and not sure why. Also, generally looking at their stance, looking at their movement, looking at their range of motion. So things like their hips ability to rotate in and out, that's important for me to know. Their ability to bend forward, their ability to come on up. And what's happening with the pelvis as they are doing these motions tells me a lot as to where we might need to strengthen, where we might need to stretch, where our body may be compensating in some ways. All of these things I'll look at on first day because this is going to be one of the main things that's affecting our woman is going to be just that pain. And we want to make sure that they can get through things like taking care of the baby without having to worry so much about that pain affecting them.
You raise a great point that being able to care for your newborn baby is a huge concern for new moms. And I can imagine as a dad, I've had a front row seat of watching my wife come through a couple of these pregnancies and it's hard to be mom the way that you want to when you're not feeling your best and realizing
Exactly.
that there are some solutions out there. So it's great that you're bringing attention to this.
I just had a conversation with a new mom not too long ago. It was earlier this week that she was saying how, and she just had her first baby. She was saying the struggles of what it takes to not be a mom, but then also try and work, but then also be a wife and be a caretaker, things like that. And all the while still trying to now get back to who she was, get back to her body and things like that. And it's difficult. It's difficult. And if you add on pelvic pain or pelvic girdle instability on top of these things, and now where you're having people with restricted movement, they feel they can't even take a few steps without me having to sit down, things like that. It's hard to function. It's very hard to function. It makes life even harder for them.
Can you shed a little bit more light in? You're talking about that recovery from pregnancy and labor and delivery, the difference you've seen in your clients and patients that vaginal births versus C-sections.
Typically, the difference I've seen, for one, some people will think that maybe if they do a cesarean, that they're completely out of any kind of typical vaginal symptoms or dysfunctions or things like that that happen. It's not necessarily the case because in the end, you've gone through pregnancy, and pregnancy in itself was a change to your body. Your pelvic floor muscles had to now adjust to the weight of the baby, all of that. So that already caused a physiological change. In terms of vaginal delivery, now we have a little bit more stress onto pelvic floor muscles. That also will depend on the position that you were in labor, how long you were in labor for, if there were any tools like forceps or things that were used in accompany with the vaginal delivery, if there was any tearing or if there was episiotomy, or depending on how breathwork was. All of that can affect pelvic floor muscles. All of that can also affect the nerves that run through the pelvis as well. Some of these things can be compressed during that stage, during labor. And the difference with that versus cesarean now is the C-section, you're still going to have, that's still going to have its own ordeals. It's not necessarily going to have the same effects, the same aftermath as a vaginal delivery, but it still will have its own. So with the C-section, you have to think like you're going through a number of layers or cutting through a number of layers to get to the baby. And with this comes a lot of now core disruption. And so the biggest thing here is going to be what's happening with the core. We'll still have pelvic floor issues. It may not be to the same extent, but it can still happen just because, again, the physiological changes that happen during pregnancy itself. But a lot of what happens now is with what's going on with the core. You have to think of the scar tissue that can build up in that lower suprapubic region. So right above the pubic bone, the scar tissue that can build up there, and the pelvic organs that lay there that can be affected by that scar tissue. So this is still an area that we want to make sure that we are paying attention to. Just because we had a C-section doesn't mean that we're completely out of the woods in that area. I still have plenty of moms that have come to me for different issues, even though they had a C-section, they thought that they should have been fine. But obviously, this is still a disruption to your pelvic floor, to the pelvis in general. We want to make sure that we are addressing it. Even if we don't want to leave a C-section scar as is, we want to make sure that we are actually addressing it. Same idea as we want to make sure that we are addressing the pelvic floor muscles even after vaginal delivery.
So it sounds like no matter which style of birth, if you will, the mom has had, there's considerations that should be invested
Yes,
to make
I
a baby.
always recommend at least a follow-up, even if you're not going through a full treatment, it's okay, but at least pre-visit just to see what's going on prior to delivery, and then at least a follow-up afterwards.
I think I'm glad I remembered that because I think that's a really important differentiation. And you know this, but I've had patients society has conditioned them that a C-section is a preferred birth, and I won't get on my
Exactly.
soapbox about that one, but there's such a different set of considerations.
It's a very different set, yes.
Those abdominal core muscles get cut, and you
Mhm,
have to retrain.
and yes, and honestly speaking, those are what I prefer to train as soon as possible after
Oh, yeah,
delivery. Yeah, as
yeah.
soon as possible, and
That's
for either vaginal or cesarean.
we've got those therapeutic lasers, and those things can really help facilitate that healing process, especially cesarean wound. I hate to call it a wound, but it really is incision site.
Yeah.
Just to help the skin to heal and scar tissue revisions, muscle healing. So a lot of people are starting to talk about pelvic floor health. So it's becoming very, very common nowadays, and women are becoming more aware of it and understanding why they have certain symptoms and why certain things that maybe before they had children weren't much of a problem. Going to the bathroom, you giggle or cough a little bit and you have a little leakage, or sometimes now it's not as comfortable to have intercourse with your partner, or going to the bathroom is a little bit more challenging. All these things are coming from pelvic floor dysfunction and health. And the muscles in the pelvic floor really are used in a really strained way during childbirth, which is what they're there for, but they go through quite a workout. Tell us about how, from your perspective as a physical therapist, you can get into pelvic floor, really identify the areas that need help, and what do you do when these patients come with you with these conditions?
Typically, what I'll do is, and it really honestly starts with the history. So, just looking at what has been going on, I'll typically send my clients just a detailed history form just to fill out completely for me, going through bladder health, bowel health, sexual health, pelvic girdle, things like that. And their main reason as to why they're coming. And for a lot of people, the main reason as to why they're coming is completely different from all the other things that I see that's going on with them. Because what happens as well, especially with our moms, is that sometimes it's because they've been told this, or sometimes it's because they've been going through it however long that they just think that some of these symptoms are normal when a lot of them they may be common, but they're not normal. And so things like leaking on yourself, or having to rush anytime you get an urge to use the bathroom, you have to race to the bathroom. These are not things that are normal or should happen. happening. They may be common, but they're not things that we should see as normal for ourselves. And so when I see some of these things, if someone is putting on like the form that they're going to the bathroom once every hour, I'm like, okay, there's an issue here, but they're not seeing the issue there yet. But there's an issue there. And likely those other pieces are also affecting what they were originally coming in for. I look at their pelvis, I look at their movement patterns, I look at how different movements, what's happening with their pelvis during those different movements. I look at their breathing. A lot of times we're not breathing properly. We're getting a lot more chest breathing. We're not letting that air come all the way down towards I let the diaphragm come down. I'm going to look at their core. Many times the core is very weak. I also look at their back strength as well and hip strength. And then after that, we'll typically do a pelvic floor examination. And so that involves looking both at the vulva, which is the outer portion of the vagina, as well as internally looking at the vagina. And that consists of assessing each of the muscles within the pelvic bowl. Each of these muscles here within the pelvic bowl, testing for any kind of muscle tension, any kind of pain, range of motion, strength, looking at the fascial layers, and those things that can also be contributing to their symptoms. And then from there, I can make a plan as to what is happening. But I tell you, a lot of times I have an idea as to what's going on just based on what they tell me when we're talking. And then I typically will confirm it with the examination. But a lot of people, they will have they don't realize some of the issues that will come. So they may be coming in for pelvic girdle pain, but then within the intake, we realize that they're also experiencing urinary dysfunction or bowel issues or sexual health issues. These are different things that can happen that some women don't realize is a pelvic floor issue or is a problem. And I can expand on what some of those may look like. So that way people, if they hear it or they feel like something that they go through, then they know, okay, this is something that I may need to address. I can expand on that. For urinary health, typically, I'll give some examples of some things I might hear. It may be that one of the most common would be that, oh, I'm leaking urine. I'm leaking urine when I'm exercising, or I'm leaking urine when I cough or sneeze or laugh, things like that. That's pretty common. Again, that's not something that we want to normalize, not something that we want to make normal for ourselves. It needs to be addressed because it shouldn't be happening. Another thing that can happen would be someone is rushing to the bathroom whenever they feel the urge sensation to urinate. If they feel like they have to, anytime they get the urge to urinate, they have to run to the bathroom. There is no delaying it, there's no holding it. Otherwise, they're going to go on themselves. Another thing could be this is all for urinary, by the way. Another thing could be that they get to the bathroom and there's a delayed start. They can't seem to start for some reason. Or when they finish or they think they finish and they get up and then they feel like they have to go again. That is another issue that needs to be addressed. That's not something that should be happening. And for bowel health, again, there's so many more issues for urinary health that can happen. I don't want to take too much time exploring that. But for bowel health, we may see things like constipation. And there are different forms of constipation. Some may say that, oh, but I go to the bathroom every single day. I'm constipated. Okay, how do the stools look? Are they more of that pellet form? Do you have to forcefully push and bear down and use all of your strength to get everything out? Or is it coming with ease? Do you feel pain when you're having a bowel movement? Are you bleeding when you're having a bowel movement? Things like that we want to consider. There can also be fecal leakage as well. People find smearing on their underwear. They may find smearing. They're not sure, why that's happening, but that's not something that is normal. That's not something that we want to normalize for ourselves. For sexual health, this is a big one. And when it comes to sexual health, I usually talk about this towards the end because it's generally the one that people find the most uncomfortable. It's definitely a big one because our moms will go through this on a day-to-day basis. And unfortunately, some of them will just suffer through it. If they're having issues or pain with sex or things like that, they'll just again feel that, okay, this is not something that they can fix. So we just have to deal with it, even though maybe it wasn't like that before pregnancy and delivery. For some people, it was not like that at all. For some people, it was, and then it got worse. So for sexual health, we want to keep in mind the pelvic floor has not gotten back after childbirth. Your pelvic floor has to get back to prior state. It's still adjusting, it's still healing, it's still rehabilitating. And so your how intercourse was previously is not going to feel the same right away. It's definitely something to recognize. There may be pain with sex, there may be burning, there may be, for some people, they may experience numbness if a nerve was compressed during delivery. If they had any form of tearing, there may be scar tissue build up right along the perineum. And with that, there may be more irritation, or they may feel a lot more tightness in that area. They're not sure why. They may feel like they're now hitting a blockage that was there before. These are different things that can occur with the sexual health that also are very important to address. And it should not be shied away from at all.
You raise a lot of good points, and I think this area, a lot of people, like you said, are uncomfortable discussing it, and even with their healthcare providers, they're not sure
Yes,
if they should even bring it up because, like you said, society has trained everybody to normalize things th- that are common. And I hear this every day with my patients, but it's important for them to understand that they need to talk about this because you and I are trained in the ways that we are. We can help patients,
absolutely.
and you shouldn't have to suffer through these things. And
No.
especially there's things in life that we're supposed to do that are supposed to be fun and not painful, and we shouldn't
Yes.
suffer through those
You
things.
shouldn't suffer.
Well, especially, yeah. I'm glad you're sharing that information. It's important for women to understand that there's help for those kinds of things, and it's not taboo to talk about it. It can be embarrassing, but there's solutions out. And it's important
Exactly.
that you have a good team together to help identify the source of those issues and then come up with a good, strong plan to tackle that and to put you into a better state of health. And so
Yes.
that's great
And they're not alone with it. They're not alone.
for sure.
Yeah.
It's funny you bring up that normal versus common thing, and I get that all the time with our patients here in the office. I'll give you an example. So you have headaches. How often do you get them? Once a week, but they're the normal kind. No,
Yes.
there's no such thing as a normal headache, and oh my gosh, oh they just go away if I take ibuprofen.
Yeah.
Well, let's do something about it because you're
And
not
see,
taking
normal
ibuprofen.
doesn't mean good.
No, definitely not. So
First, they'll consider common to be normal and then normal to be good.
yeah, yeah. Oh gosh, I think that's good. Excellent. No, I think you went into that. That was great. Oh, so Dr. Sarah and I are going to talk about some different things that new moms can think about to do at home and when they're with their children and taking care of themselves. Because remember that fourth trimester and into the time after that, your body is returning to a non pregnant state and it's not the same as it was before. So you have to give it a little bit of help and you need to do your part as well. So, some of the things that I've seen with my moms in the office, especially the ones that have more than one baby, is their body just doesn't go back to the way that it was after that first baby. I use the analogy a lot. It's like silly putty. You can only stretch it and put it back together so many times. After that, it just doesn't go back the same way that it used to. So we need to come up with some strategies, some exercises, some things to do at home that can help you to feel better and help you participate in this process of getting better. One of the things that I see with my moms, Dr. Sarah's probably seen this too, is they love to hold their baby on the same hip with the same arm all the time.
Yes.
Yeah, they get that cheerleader pose and that baby's sitting right on that hip. And you do that 3, 4 months, that baby's getting bigger. And all of a sudden, oh man, that low back is just,
Yeah.
and so I always ask moms about that and make sure you're switching positions with your baby. I give them some exercises to do. One of the things I learned from one of the doulas that I worked with a long time ago was she showed us the figure eight dance to do to help those SI joints get moving. So I always show my new moms and multiple moms to do that dance, and it's a really great thing. We're talking about ergonomics and exercises and things. Dr. Sarah, what are some of the things you've seen that you help your clients with, your patients with, that are really helpful with that fourth trimester and beyond?
Yes, I completely agree. One of the first things I tell even prior to, but definitely after childbirth, I was like, please try as best as you can to not keep baby on one side because everyone will have a favorite side. Oh, but this is the side. And then slowly you start seeing a little bit of change happening just because that baby is sticking on that side or they're only carrying the car seat on that side as well. Or so I tell my moms just switch sides as best as you can, just to not put too much emphasis on one side. The other thing is core. Core is really big, especially just directly after childbirth. Core is really big because in order for you to be able to get as much out of your day, as much movement out of your day, as much energy, things like we want to make sure the core is getting stronger and stronger. I actually tend a lot more to focus on the core prior to the pelvic floor, just because the core is so important for moms right after childbirth, just to replenish, just to revitalize. We want to get them as strong as they can because the job is starting all over. They're getting it. There's so much more to do now that baby has come. And if they are not feeling their bodies strong enough, then it makes it all the more difficult. And so we want to get that core going so that way they don't feel weak, things like that. The other thing I say to people is that contrary to popular belief, Kegels are not always the answer.
What?
Kegels are not always the answer.
You heard it here first, folks. Kegels are not always the answer. So tell us what is.
What I'll say is that there are different spectrums as to when a Kegel might be the answer, but honestly, there's so much more surrounding the hips, surrounding the core. Like I said, when I talk about pelvic floor, it's not just pelvic floor; it's the pelvis accompanied with the core, accompanied with the back, accompanied with the diaphragm. There's so many more components surrounding this that just doing a Kegel is not going to make things better. It isn't going to fix the issue and sometimes can actually worsen that issue. Yes, it depends on the case. But if someone is really tight or their pelvic floor muscles are, there's too much tension because maybe pelvic floor is compensating for the core and the low back not activating well or things like that, then we're not going to be doing Kegels because that's not going to help. It might actually make the pain worse. Things like that. It's just a matter of getting that equilibrium. Like I said, focusing on getting the core stronger, getting the pelvic girdles looking good, getting the low back functioning, the paraspinals working well. Make sure that their breathing is good, that they're not just shortening their breath up at the chest. These are things that are going to start actually helping the pelvic floor without even addressing or without even almost like touching the pelvic floor just yet. These things will already be helping.
A good plan with goals, reasonable expectations is an important thing. And it sounds like Dr. Sarah, you have
Absolutely.
a great plan for your patients. What is your favorite exercise to teach your patients to do at home?
I'd start with how to breathe because there are different factors in that. With learning how to breathe, either maybe I'll do like a pursed lip breathing or I'll do a 360 breathing or something like that. But I'll do some of the breathing technique with them. And I start with that, accompanied with some other things, but I'll start with that primarily because it tackles quite a few things. It'll tackle just general breath work, getting the diaphragm to lower, things like that. It starts to tap into our nervous system, our parasympathetic nervous system. So working on that ability to rest and digest, which is what we need, especially with the stress and increased anxiety with now a newborn and all the other things that are coming along with that. We want to be able to take time to regulate our body's ability to calm down, to get back to normal resting state. The breathing will help with that. It is a precursor to getting the core working as we start to exhale, if we put our lips in a certain position, as we start to exhale, the core now starts to engage. Even if it's just a little bit, the core will start to engage. So we're starting to get even a little bit more activation in our core. And then our pelvic floor muscles also start to lengthen. So they will lengthen and then relax. And so now our pelvic floor is now getting a little bit more range of motion. It's getting a little bit more mobility. It's starting to calm down from the stress per se of the delivery, things like that. So that is definitely a go-to because it gets a lot of things all at once.
I really appreciate all the expertise you've shared today, Dr. Sarah. It's clear, obviously, that chiropractic and physical therapy are very much two peas in a pod when it comes to managing pelvic floor pain and helping women move through that supported through that last part of being pregnant and having children and helping them with those symptoms that kind of come from that process. So, for any moms out there that are looking for some more answers and want some help with pelvic floor health and alignment, helping to get stress off that nervous system, please reach out to us at Jaffe Chiropractic or at Healing Hands Pelvic Health and Wellness. Both of us are all over social media. You can find us on the web. If you want some help, you can always put a message below, put pelvic floor, and one of us will reach out to you and get you some information and try and help. Because, like we said earlier, this is something that you don't have to live with, you don't have to deal with. There are resources, there is help. You can get better, and we are here to help you with that. So, we hope to be able to support you on your journey to feeling your best. Take care.